So,
Yeah.
like I said earlier, many of us don't understand public health, okay, or its importance. So let's start by you telling us what public health is and what the public health projects that you are involved in.
Yeah, thank you. So, I'll simplify it.
Okay.
So basically, when um, people think about healthcare, they think about healthcare about going to see the doctor
Mm.
anytime. So, so when seeing the doctor, that's health. That's an individual seeking health. So when
Okay.
the doctor saves that life, that is a doctor saving one life at a time.
Yeah.
However, there are many policy and practice decisions that can save lives in millions. And so those policy practice issues
Yeah.
will fall under public health
Okay.
because they look simple, but they save lives in millions.
Yeah.
And a simple example is something like institutionalizing hand washing. So
Okay.
it's very simple. It's something that people do at home. It's something that people do on their own.
Yeah.
So putting in place just making sure that there is hand washing because it's something that saves lives in millions,
Yeah.
So making sure you prevent all possible infectious diseases just through washing of hands
Yeah.
is a public health thing because you have to make sure that you take policy decisions that make sure that the water is available, that the soaps are available, and you have to put them in places that is open to the public and can be accessed. So not just you put them in parks, public toilets, make sure, everywhere that people can wash hands.
Yeah.
So as simple as that intervention is, that's one example of what public health is. So it's not just as saying as simple as telling people go and wash your hands,
Mm.
go and wash
Mm.
your hands.
You
So
you
making
you
sure,
enable them by making sure the tools and whatever is available. Yeah.
yes. So that's public health. So I've had the unique opportunity of working on multiple public health projects. So and then so I would say to expand further on what public health is, you would have to then think about, I've just used hand washing as an example. So making sure first people are educated, are well informed, and are able to use the knowledge they have to take action
Mm.
at the everywhere you find individuals to wash their hands at the individual level. Take it a step further. You need to make sure that communities are committed to preventing diseases through hand washing. So that is where community practices, community structures, community resources now come under.
Okay.
And when you take it another step further, you now take it to policy decisions. So what policy decisions are going to impact these hand washing behaviors, and how do you make it openly accessible to people? Do people have to buy water in public places just to wash their hands?
Mm.
Will you make the water freely available? And then as all of these things are happening at the individual level, community level, and then at the policy level, with a more national or regional spread, you
Yeah.
then have to then think about what effect is all of this having in preventing infectious diseases. So that's where the data comes in.
Yeah.
So being able to manage the data, making sure that people are looking at the effect on infectious diseases and making sure that it's being used all the time, being updated all the time to prevent just those infectious diseases.
Mm.
It's through hand washing. So in summary, public health is broad. It's
Yeah.
so it cuts across both behavior change at individual level, helping communities, mobilizing them, and building coalitions towards certain desired change that one health changes that one want to observe.
Yeah.
And then the policy decisions, making sure there are resources, making sure that the data is made available. So that's in summary, that's public health.
Okay.
So